Very much, and I wanted to echo those same comments that we've just heard. To thank all of you for being here. It is very important that everything's okay. It is very important that we have civic discourse just like this, because it's you that make this kind of change possible, whether it's voting yes or voting no. Learning more about these issues that really impact all of our lives is what's most important. And the fact that all of you are here, it means a great deal to me as a fan of civic discourse. And last but not least, I want us all to do one more round of applause to thank our panelists right before this debate. Thank them for being here tonight. Passionately, whether it's for the issue or against the issue, it is a great service to all of us to have folks like this here tonight. So thank you for being here. We're hopefully going to be able to share a lot of information with you tonight that you could share with your friends and family, and hopefully get more folks informed about how you feel about this important issue. First of all, let me lay out what's going to happen for the rules for tonight's debate. What we're going to do is start with some opening comments from each of our panelists, and then we have a series of questions that each side has prepared that I'll be asking each side. Each side will have an opportunity to answer each one for about 3 minutes. Then we'll offer a 1-minute rebuttal. And then at the end of those 4 questions, we're going to be taking questions from all of you. As you walked in today, you saw a little index card and a little golf pencil. If you have a question to offer, please, you'll see representatives just like Cherish over there waving her hand. Folks here to help you out, to get those questions from you so you can be part of the discussion. Each question, again, will get a 3-minute response from each side, and then a 1-minute rebuttal from each side, and we'll move forward. At the end of the debate, we'll offer another 3-minute closing statement and go from there. So again, this is part of a series. We'll be in Steamboat, I guess, tomorrow, and then Grand Junction on Thursday. We're just very happy to have you here. Again, you get more information from all the websites, but really without any further delay, let's get to it. First, let me introduce our panelists and give you a little more information about them. I'm going to start from my left on this side. Grace Marie Turner joins us. Grace Marie Turner is president of the Galen Institute, a public policy research organization that she founded in 1995 to promote an informed debate over free market ideas for health reform. She has been instrumental in developing and promoting ideas for reform to transfer power over healthcare decisions to doctors and patients. She speaks and writes extensively about incentives to promote a more competitive, patient-centered marketplace in the health sector. She testifies regularly before Congress and advises senior government officials, governors, and state legislators in health policy. And she was named by House Speaker John Boehner in 2013 to serve as a member of the Long-Term Care Commission. Previously, Grace Marie served for a 3-year term on the National Advisory Board for the Agency for Healthcare Research and Quality, and she served as a member of the Medicaid Commission, making recommendations to modernize and improve Medicaid. Sitting next to her is Linda Gorman. Linda Gorman is director of the Healthcare Policy Institute at the Independence Institute, a state-based free market think tank in Denver, Colorado. You may have heard about them. A former academic economist, she has written extensively about the problems created by government interference in healthcare decisions and the promise of consumer-directed healthcare. In addition to her work for the Independence Institute, she has written for professional journals, periodicals, newspapers, and specialist blogs. In 2015, she was appointed to the Colorado Commission on Affordable Healthcare. Going to my far right on the end, we have Dr. Irene Aguilar. She is the only practicing physician in the Colorado State Legislature and the force behind the creation of ColoradoCare. Born and raised in the inner city of Chicago, she moved to Denver for her residency training. For 23 years, she worked as a primary care physician for Denver Health and Hospitals and now serves on its board of directors. When the state senate is not in session, she practices medicine at Clinica Tepeyac, caring for the uninsured. Having a child with developmental disabilities led her to participate in public service. She was first appointed to the Colorado Developmental Disabilities Council and served on the Vulnerable Populations Task Force of Colorado's Blue Ribbon Commission on Healthcare Reform. Her experience has transformed her into an advocate for universal health care. Senator Aguilar made the decision to seek public office in 2010, in part to ensure access to quality, affordable health care for all Coloradans. And finally, to my immediate right, T.R. Reid. He is the New York Times best-selling author of The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare, a documentary filmmaker and a former reporter with the Washington Post. At the Washington Post, he covered Congress and 4 presidential campaigns and served as the bureau chief in Tokyo and London. Reed has made documentary films for National Geographic Television, PBS, and the A&E Network. The Healing of America and his 2008 documentary, Sick Around the World, both examine how other developed countries in the world provide high-quality universal health coverage for everyone at a fraction of the cost that Americans pay. For his most recent film for PBS, U.S. Healthcare, The Good News, he traveled across the country to study communities that provide first-rate health care below market costs. Reed says that ColoradoCare will be a win-win for Coloradans. It gets everybody covered, it saves billions in administrative costs, and it gets Colorado out of Obamacare. Now, a few ground rules. We've gone over the minutes for each side that will have a debate. But again, for all of you, like I said before, this is a great service to our community to have folks on both sides of this issue here to talk to all of us. So I will ask that you keep your comments and applause reserved for the end of our debate so we can appreciate all of our speakers at the same time. Please keep your comments to yourself until that time. And again, if you have questions to add to the debate, please write them on the card and get them to our volunteers at each side of the room. We'll be sure you're part of the discussion. Finally, I have a coin here to flip to see who begins our opening statements. Senator Englewood, would you like to go ahead and call coin in the air? We'll be an elected official.
I would say heads.
And it is heads. So you get to decide if you want to. We'll start with our opposition to start the opening statements. And again, what we'll have is 3 minutes from each speaker. We'll have 3 minutes from one speaker from starting with the opposition, and then the pro side, and we'll go back and forth from there. Then we'll get into our first question. So who will be starting off on this side?
Thank you very much. Thank you, Dominic. Thank you, Jennifer. Thank you to my fellow panelists, my fellow debaters. Also to Cherish for all you've done to make this happen, and to all of you for coming. So in the Washington, D.C. area where I work, one of the things I try to do is help build consensus. Let's just start with what we agree on. And there's several things that I'd like to at least offer as a starting point for our discussion. And that is that neither side, I think, believes that either our current system or Obamacare is the answer to all our problems. It's not the best we can do. I think we'd also agree that there are real problems in our health sector that still need to be solved. I think we'd agree that we want everyone to have access to care and ideally insurance to protect them financially. And that the most important goal is protecting vulnerable people who have nowhere else to go for coverage and who need to make sure they have access to quality health care that is really a bedrock of our community and our society. So with that premise, talking about ColoradoCare, I think it's also helpful as an analyst to look at what we know about systems like this, or others who have tried a similar approach. Vermont also saw the Section 1332 of the Affordable Care Act as an opportunity to move forward with a universal health care system. After 4 years and spending $2 million on studies, the system was really roiled politically. The governor nearly lost his election. Governor Shumlin finally pulled the plug on Vermont Care. We can talk more about the details of this later. He said the risk of economic shock is too high from the taxes that would be required to pay for the system. Vermont has about 500,000 people, so they feel they were enough of a sense of community. They knew where the resource sources were. The provider community really wanted to get to universal coverage, and they couldn't do it. The second example are the co-ops. Co-ops were, yes, they were sort of a backstop to the public option that many people wanted in the Affordable Care Act, but this would allow people who are citizens to come together in a kind of cooperative that we see many examples of in our society to pay the bills to make sure that the people who enrolled in their co-op would be able to get the care they need. $2 billion went into funding the 23 co-ops that were started around the country. More than half have failed, including, of course, Colorado's. Colorado got $57 million in startup costs. It wound up covering 14 million people. And it would have, I see my time is up. The only way it was going to be able to survive was to call the loans that it had gotten assets. This is not a sustainable model. And I think in my closing, I'll go through the uncertainties that I see and the kinds of questions I hope we hear today, and that I think we will also want to ask before we take too much of a leap down this road. Thank you very much.
Hi, everybody. I'm delighted to be here. For me, an exciting Friday night is watching Dominic's show, so I'm glad to be here with him. I really admire the Independence Institute, and I'm glad that they did this debate because they're right. Coloradans face a stark choice this November, and we only get two choices. We can pick ColoradoCare, a plan that will cover everybody and save billions, or you can vote no, which means you're voting for the status quo, which is Obamacare and our health care directed by out-of-state insurance companies. And you got, whatever you say about ColoradoCare, you got to like the fact that we have the Independence Institute asking you to vote for Obamacare in November. That's a change. Now, what I'm going to do is tell you about the system we're stuck with now, and then my colleague, Dr. Aguilar, is going to explain to you how we're going to make it work much better. Here's what we've got. The Affordable Care Act is crony capitalism for the insurance companies. They have made out large, and they've done it by, the Affordable Care Act taxes all of us to pay subsidies to people who can't afford to pay insurance premiums, and the reason they can't afford them is because the insurance companies constantly gouge us. For next year, their average price increase is 17%. They're going to raise your health insurance premium 17%. And that's what my colleagues here want you to vote for in November, a 17% increase. And while they're gouging us on price, the health insurance companies based in Indiana, Minnesota, Hartford, Connecticut, are reducing coverage. For one thing, they dictate which doctors you can see. They have these networks of doctors they'll pay for. If your doctor isn't in the network, tough. My friend Elizabeth in Denver has a 7-year-old with congenital disease. All her life, that little girl has gone to the same pediatrician. This February, United Healthcare told him, sorry, we don't cover Dr. Cooper anymore. Tough. That's the system we're stuck with now that they want you to vote for in November. Now, they make a big profit in insurance, and there are two ways to make a profit in insurance. One is tax everybody to pay subsidies to them. They got that deal. But they also don't want to pay bills. So they set the deductible at $4,800, $6,700, which means all of us get to pay the premium every month, but we never get to use the insurance. No wonder all the insurance companies have seen their stock double since the Affordable Care Act passed, the act that my colleagues here want you to vote for in November. And finally, they failed on the most important goal of all of a healthcare system. They don't cover everybody. The current system leaves more than 350,000 of our fellow Coloradans with no health insurance at all. Now, to me, that's disgraceful. In a rich, compassionate state, we ought to provide health care for our neighbors when they need it. But it's also stupid, because then those people get very sick, and they go to the emergency room, the most expensive place in the world to provide health care, and we all get to pay for it because they're not insured. Our proposal is, let's cover everybody, let's save money, and let's put the control not in Minnesota and Indiana, but right here in Colorado. And my colleague Irene is going to explain how we're going to do that. Thanks.
No clapping.
I want to point out that what you're going to be doing is voting on the initiative, which is a very specific set of words that has meaning in law. It's not a vote for or against Obamacare. It's a vote for this initiative. And there are bills in Congress that will do a lot to correct Obamacare. I'd also like to point out that it was people like me, and one of the bills, by the way, Cassidy Sessions' bill, you should read it. It's got some very good ideas in it. It was people like me that warned that these kinds of things would happen to Obamacare. And people like Grace Marie who warned what would happen. The things we talked about have come true. Now we're going to warn you about what's in this initiative, and I think it might be worthwhile to take what we're saying seriously for that reason. We were right in the past, we're likely to be right in the future. So what's actually in the words of the initiative? First of all, it creates an oligarchic body which has a monopoly over how much physicians get paid in this state. It will set the prices, and you will have no recourse about what you pay or what people can collect. It's immune from the regular checks and balances of government. It's outside government. It does not provide you health care. The initiative, health insurance, the initiative specifically says that. So you can only get the health care that this body decides to give you. Its elections are also outside the regular parts of government because it's exempt from TABOR. And TABOR specifies when elections have to be held and how propositions have to be put to the public. So they could decide to hold elections in Lake County on December 31st at midnight and bus people in to raise taxes. There's no controls on the elections. Eligibility is you've got to be a resident. Well, what's a resident in Colorado law? Somebody with an address, a post office box, a vacant lot. Somebody who says he's a resident. It's not defined in this law. And basically it also says, well, you can only vote for the board if you've been here for 12 months. How tough is it to get a library card in an era of fake documents showing that you've been a resident with a fake electric bill? Won't be hard here. What this does is it makes Colorado the health care provider to the world. Second thing it does is it gives Colorado the highest taxes in the country in terms of income taxes. It taxes wage and salary income, puts a payroll tax on low-income people. Somebody on Medicaid who works part-time is now going to have to pay 10% of their wages, and yeah, it's employers pay, you pay, everybody pays, whereas now they don't have to pay anything. So we've got taxes, eligibility, uncontrolled body, and then the way you have to think about this is to look at the systems that are arranged like this, systems with price controls, systems that are financed by taxes, and systems that aren't accountable because there's no choice, and only choice gives good accountability. And there are systems like the Veterans Administration, which was killing people on secret waiting lists, and there are systems like Canada, where there are 4 or 5 million people who are looking physicians because they have shortages in every aspect of their health care. Yes, it doesn't cost a lot, but coverage is not the same as medical care. And in countries that don't have profits and don't have freedom in their health care, you can have coverage, but you can't get care.
Particular?
Thank you again for this opportunity to speak with you. As was implied here, what ColoradoCare is our opportunity to apply for a waiver from the Affordable Care Act. There is a section of the Affordable Care Act that becomes active in January of 2017, and this section says, states, the ACA is the best we could do at a national level. If you as a state think you can do better, please go ahead and try, but you need to show us that you're going to cover at least as many people, that you're going to provide at least as rich of a benefit, that it's going to be the same level of affordability for the people, and that you are not going to further increase the federal deficit from what would otherwise happen with continued implementation of the Affordable Care Act. Well, ColoradoCare basically allows us to create our own Colorado-based state healthcare system. We would put all of our healthcare dollars into a nonprofit Colorado Healthcare Trust Fund managed by a board of trustees that we elect to represent our interests. Coloradans are the shareholders. They are obligated to people and not profits. We can be sure everyone pays in, although this will be according to their means. There is a 10% payroll tax, however it is split between employers who will pay 6.67% and employees who will pay 3.33%. The average employer who now provides health care benefits for their employee pays an average of 13.5% for skimpy insurance and the medical portion of workers' compensation. For 6.67%, they will get robust insurance for all their employees. And as for the individual, a platinum plan, and that's the level of benefit we're talking about, on Denver's Health Exchange costs $16,800 annually. What that means is that even a self-employed person would need to be making over $168,000 annually to be paying more than this in ColoradoCare. Just like other payroll taxes, the self-employed pay both portions. But this is tax deductible from your federal wages, so that your total effective tax rate is 5.5 to 8.5%. We can provide everyone with comprehensive health benefits that include all the benefits required under the Affordable Care Act, with robust coverage of mental health needs. ColoradoCare has to qualify for this waiver, and so you're guaranteed at least a silver level of benefits in order for us to achieve the waiver. We can truly eliminate medical bankruptcies. Deductibles are not allowed. Co-payments are prohibited for preventative and most primary care services. Co-payments may be waived if they prevent people from getting the medical care that they need, because we know that if people don't get the care that they need, they still end up sick and they still end up costing us money. We can simplify administration, we can save patients hours of time and anxiety, and we can decrease provider burnout by not having such a complex system. We can pay good salaries to frontline providers and give competitive reimbursement to hospitals. We can prioritize caring for our most complex, costly patients, and by doing this, we will save money. Critics imply that this is new spending. What we the people need to remember is that the $25 billion collected by ColoradoCare replaces the $30 billion that we are currently spending on health insurance premiums and out-of-pocket costs. And you can go to www.coloradocare.org and use the calculator to compare your cost online. Thank you.
Okay, I want to thank both sides for their opening comments. Again, as a reminder how we're going to run this, I'll have 4 questions that each side of our debate here prepared two questions for each side. So we'll go through each of those 4 questions. The opposing side to the question will have 3 minutes to answer. The side that asked the question, through me, will have 1 minute as a rebuttal. We'll go back and forth, again, a total of 4 times. Then we'll get to your questions. Again, you need to submit those on an index card. Give them to one of our volunteers. They're at the back of the room. So be sure you get those to them if you want to be included in the discussion. So our first question will be from the proponents to the opponents. And we'll ask one person from the side to answer this question in 3 minutes. You can see the timer down there. So our first question is, the status quo health insurance system under the Affordable Care Act creates a gross imbalance between the corporate insurance industry and individual Coloradans. Insurance corporations dictate which doctors and providers Coloradans can see through the narrow networks insurance companies establish. And they set and raise premiums without any accountability to the people of Colorado. Insurance premiums are projected to increase by an average of 17% next year, with some insurance premiums raising as much as 40%. What is the justification for supporting a system that favors corporate profits over patients' benefits and allows skyrocketing premiums and deductibles to continue increasing at the expense of individual Coloradans? So I ask the opponents, you have 3 minutes, and you can share the 3 minutes, that'd be just fine, but you have 3 minutes, and the microphone's right there.
I don't think there's any justification. Do we have the microphone? No.
I don't think there's any justification for that. We want individual choice. We want people to be able to choose the kind of health insurance in a market that's truly competitive. The one that we have is not truly competitive. And Mr. Reed said that we are implied that Linda and I are supporting the status quo and supporting Obamacare, which is not true. And you will hear, for example, tomorrow that Speaker Ryan is going to be releasing a reform plan to replace Obamacare with one that would return choice to individuals, that would restore much more power to the states, and that would lead to true reform. So it's really not an either-or choice. There are other options moving forward in the future.
I think actually profits are usually good for people. The problem with the situation now is that we passed Obamacare, and Obamacare forces you to buy insurance that people never bought before and forces you to pay premiums. It is overseen by the state. The Division of Insurance can say that the premiums don't happen. And so if you don't like that kind of oversight, I don't see why you're going to like the oversight from ColoradoCare, which isn't even subject to the same checks and balances that the State Division of Insurance is. For example, in rural areas, they are now screaming at their senators here in Colorado because their insurance premiums have gone through the roof thanks to Obamacare. Under ColoradoCare, it's by population, so the Front Range is going to control things. Things are a lot better in the Front Range. Where are you going to have your senators based on geography? Second thing to keep in mind is administrative costs. People say the administrative costs will go away with the insurance companies. The problem is the insurance companies are actually pretty efficient at doing what they do, and if you really want to see bad administration, try Medicaid, where a physician that I talked to this week says a patient came in for a kidney stone. She needed imaging right away to try to make the person comfortable and see how bad the kidney stone was. And then what happened is she couldn't do it because Medicaid says that if you're going to need imaging on an immediate basis, you have to send the patient through the emergency room. So she had to have the patient walk down to the emergency room, pay the emergency room rates, and then they got the patient taken care of. That's what happens when you keep the efficient insurance companies who have a reason to do things out of the way. But they've taken over too much because Obamacare gave them basically a product, again, with no competition. The answer is not to socialize Colorado medical care. The answer is to get rid of the monopoly position of the insurers and give people cash if they need it and let them spend it as they see fit or something like that. And I can give an example from Colorado Medicaid program that's actually working quite well, but you never hear discussed.
Okay, that's perfect.
A teaser.
With 10 seconds to spare.
Ask me.
So again, we'll ask the proponents who proposed the question to have 1 minute to respond.
The insurance companies are not efficient. That's a ridiculous statement. They're the least efficient payers of health care in the world. The American insurance companies have administrative costs of 20%, 20 cents of every premium dollar pays for no health care. And guess what? They wrote that into Obamacare to protect themselves so they could still charge those high rates. They're not efficient. The most efficient payer in America is Medicare, and we are creating a system like Medicare for All. Medicare's administrative costs, 3.8%. Ours are going to be about 4%. This is one of the reasons that we save everybody money. Last year, the insurance companies that they like so much charged Colorado firms and families $30 billion for premiums, and they're going to raise it 17%. ColoradoCare costs $25 billion, and the Secretary of State, the State Treasurer said, my God, $25 billion tax increase. And I said to him, you're the State Treasurer. Don't you know that 25 is less than 30?
Okay, thank you very much. Time for our next question. This comes from the opponents, so we'll go to our answer from the proponents first. ColoradoCare applies a new income tax and a new payroll tax. In addition to salary and wage income, the income tax applies to interest, dividends, retirement income, capital gains, home sales, business sales, S corporation business profits, and royalties. What do you think having the highest income tax in the nation will do to A, Colorado employment, B, the value of Colorado assets, and C, the population of high-income earners who choose to make the state their home? So may I ask proponents for a 3-minute response?
Thank you. So actually, ColoradoCare, I want you to remember this, it replaces the $30 billion that our employers and working families are now paying into our profit-driven insurance market with a $25 billion premium tax that is now deductible for all Coloradans. And that goes directly into a Colorado-owned and operated healthcare trust fund to pay for their medical care. It is misleading to imply that this is a new tax in that we are already paying this, but doing so in such a complex manner that we waste 25% on administrative costs, and who knows how much we waste on profits. Additionally, most Coloradans are paid through wages, and so the increase for them of 3.33% replaces their current premiums. In my case, as a state of Colorado employee, I pay 12.35%, and my employer pays 38% of my income for my health care. The average Colorado household earns $61,303. As I mentioned, in 2016, a platinum plan cost $1,404 per family. That same family under ColoradoCare would only be paying $180 a month instead of $1,400 a month. So that ColoradoCare will give these families financial security and protection from the risk of medical bankruptcy and provide them with extra income that they can then use for basic necessities of life or to save for retirement or college. Like Medicaid, this will contribute to significant economic growth in our state. Contributions are capped at $350,000 for an individual and $450,000 for joint filers, and less than 5% of Coloradans are at this income level. Social Security and retirement income is also exempt for the first $33,000 for an individual and $60,000 for a couple. And in 2014, half of all older American households received less than $37,000 in yearly income from all sources. So most retired people will not be needing to contribute at all, and in exchange will have protection from bankruptcy. According to a 2014 Forbes article, married couples age over 65 have a median yearly income of $44,718, again, well below the $60,000 that is excluded. And according to the Commonwealth Fund in a report released last week, up to 25% of seniors on Medicare are at risk for medical bankruptcy. There is no out-of-pocket maximum with Medicare. With ColoradoCare, none of our seniors are at risk for medical bankruptcy.
Okay, thank you very much, Dr. Aguilar. We have a 1-minute response from the opposition.
So one of the things that I think we really need to be comparing apples and oranges. When they talk about Medicare administrative expenses, Medicare doesn't count the taxes that are collected by the IRS, the payroll taxes. It doesn't count Social Security's collection of premiums. It doesn't count HHS's, all the regulation writers, all the rules, all the buildings. There are a lot of things that are built into the cost of Medicare that don't count as the administrative cost. So I think it's important to really make sure we know what we're talking about. And when you look at fraud and abuse, that's one of the things that we really need to make sure is that Coloradans are protected from people who might misuse these funds. Private companies have about a 1 to 1.5% loss rate to fraud. Medicare and Medicaid have a 10 to 15% loss to fraud and abuse. So those costs are all going to have to be built into the system, collecting the premiums, distributing, paying the bills. You cannot wish away these costs. They are very real.
Thank you very much. Off to our next question. We have, again, this is from the proponents, going to the opponents for a 3-minute answer. Under the current insurance system, Colorado has over 350,000 residents living with no health insurance, and more than twice that number underinsured with high deductibles that often make their insurance unusable without entering a state of medical bankruptcy. Given that the alternative to voting for ColoradoCare is to vote for maintaining a system that leaves hundreds of thousands of Coloradans without health care, and assuming that you are not going to let Coloradans die from lack of health care, how specifically do you plan to care for the uninsured in Colorado, and how specifically do you intend to pay for their care? 3 minutes to our opponents.
You know, unfortunately, many of the problems in our health sector and much of the financing in our health sector comes from the federal government. So this is a very difficult problem for Colorado to solve on its own. And in fact, this is going to be a bit of a mother may I, because many of the requests will have to go to Washington to do what Colorado wants to do with ColoradoCare. So whether or not the federal government allows this is really a big question. But in order to really have a solution to the uninsured, we really need to have all of these funds aggregated. We need to make sure that Washington is setting a new system of rules. that allow people to have more flexibility with the kind of coverage that suits them, to make sure people at the lower end of the income scale have the resources they need to be able to purchase coverage, and to make sure that everybody is operating under a system of rules that really are fair. So yes, there are resources in the system, huge subsidies for employer-based health insurance, huge subsidies for Medicaid, S-CHIP, the VA, Medicare. But if we give people more choice and more competition, and we have a lot of evidence of that, people make smart choices, and the market responds to that by making healthcare more affordable and efficient and responsive to what people want, not bureaucracies.
I think that you need to think about whether, about the fact that healthcare is a trade-off between all kinds of things. There are times when I was young, I didn't need health insurance so much as I needed a car, I needed to be able to get to a job, I needed to be able to, pay for my education. And health insurance at that point, I knew that I really sort of didn't need it because I had no assets, and I was eligible for Medicaid if I stopped working. So there's a whole group of people who don't need health insurance, but we are forcing them, instead of making a choice, to purchase ungodly premiums at ungodly expense, things that they wouldn't normally purchase. Now, there are a lot of other ways to take care of the uninsured. One of the ways they used to take care of it is that they funded public hospitals. If you were ill and you needed help, you went to a public hospital. They were pretty efficient. The reason they were pretty efficient is the money went directly to the clinicians. They allocated as they saw fit, or as the administration saw fit. What was the pressure against it was a lot of people didn't like being in wards and so forth, so they took care of themselves. There are all kinds of ways you can handle this, but to force people to buy health insurance when they don't want to and they don't need it is wrong. They should be free to spend their money as they see fit. And if they end up on the public system, then you're paying for it. But if you're subsidizing their insurance or paying huge taxes to ColoradoCare, you're still paying for it. So the question is, which system is the least expensive way to do it?
Okay, thank you very much. And a 1-minute response from the proponents.
Well, I'd respectfully say I didn't hear any answer to the question we asked. How are you going to cover the 350,000 people in Colorado who don't have insurance today? We ought to provide health insurance for everybody. And the notion that we'll send them to public hospitals, we do that now. Denver Health, uncompensated care, their bill is $400 million a year, which we all get to pay because those people don't have health insurance. Our suggestion is everybody has health insurance. Everybody pays for it. We don't have to pay the bills for the freeloaders who then who decide they'd rather buy a car than get health insurance and then end up in the emergency room. Everybody pays, everybody covered. We don't have anybody in our state without health insurance, and we all come out ahead. ColoradoCare is the way to do it. We just asked the other side, what's your plan to cover those people? And we got no answer.
Okay, thank you very much. Let's get to our next question, which is, this is going to be from the opponents. And so we'll have the proponents start with a 3-minute answer. ColoradoCare confers health benefits on all residents. Residents do not have to pay Colorado income taxes or be U.S. citizens. In an age of easily forged documents, there is no way to verify if someone is or is not a resident. Won't this make Colorado taxpayers healthcare providers to the world? Again, 3 minutes for the proponent's answer.
Thank you. So we did do research on this topic, and we could not find any evidence of in-migration based on health coverage. We looked at when we expanded Medicaid. As you may know, Colorado is the only state, we're bordered by states that did not choose to expand Medicaid, and we've not had immigration related to that. Nor did this occur in Canada when one province, Saskatchewan, began with a Medicare for All program and the other provinces did not have it. We found that migration patterns tend to be determined by family presence and the availability of jobs. The United States actually already does provide health care to everyone who presents to an emergency room, whether or not they can pay. And when they can't pay, the costs are passed on to the people who do have insurance in the form of higher premiums. And often people delay seeking medical care because they don't have the ability to pay for it. And so when they are finally really sick, they show up. And what happens often is at this point, They are left with significant disabilities, which require us to further support them into the future, or they may die. In fact, it's estimated that over 300 people in Colorado die each year because they were not able to access the medical care that they need. And so I think that by creating a system where everyone pays in and simplifying the cost and administrative overhead, we can be sure that we are paying less for high-cost care, more for upfront quality preventive care, and save ourselves money overall, because in the end, we all pay for this with our premiums right now.
Okay, thank you very much. Let's get to an answer from the opposition.
Massachusetts was one of the first states to try to move toward universal care. And after its reform plan passed in 2006, where they dramatically increased the number of people with health insurance in the state, they actually found that more people were going to emergency rooms than before. And that's because it was so hard to find a physician, that the system had really become clogged and overcrowded, and they couldn't find a doctor to see them. There are better ways to solve this problem. And one of the things that Speaker Ryan is going to be talking about tomorrow is a plan that would provide resources to people who do not have the option of job-based coverage, Medicare, Medicaid, VA, state children's health insurance. Make sure that they have access to the resources to pick a plan that the state provides, and if they don't buy that plan, they would by default they would be bought into a pool of providers in their community. So they would have coverage even if they don't purchase a plan. That's the way to get to universal coverage. Give people a choice, but protect them if they don't.
Okay, thank you very much. With just about a half an hour left, the time we have here at this venue, we're going to get to your questions now. We're going to change the model a little bit, so I hope the panelists are okay with just changing the rules a little bit. It's the fun part when you have to be a moderator. They give you the microphone so you have to decide these kind of things. So we have questions from all of you. We'll be going back and forth. What I'm going to do is offer 2 minutes to each side. So that way we'll have 2 minutes. We'll have equal time from each side to answer each question, and we'll try to get to as many as we possibly can. So again, if you haven't already filled them out, you can get them to the back of the room. We're trying to get through as many as we possibly can. So we'll ask the question. We'll ask each side to offer 2 minutes as an answer. We'll go back and forth in order of who answers first. For this one, we'll start with the proponents. This question comes under the subject of Medicare. Since Medicare is the primary insurer under Amendment 69, does that mean that seniors have to pay for both Medicare and Amendment 69, yet receive little benefit from Amendment 69? And we'll start with 2 minutes from our proponents.
Thank you. Sorry. No, turned it. Okay, there we go. Thank you for the question. So, as I mentioned, the premium tax and the income tax is collected across the board. Most seniors are retired and get most of their income from retirement and pension income. And again, as I mentioned earlier, $33,000 for an individual, $60,000 for a couple is exempted from that. The median is lower than that for seniors. And what they get in exchange is that ColoradoCare becomes their supplemental plan. A supplemental plan in the state of Colorado costs approximately $4,080 a year. Under ColoradoCare, if you as a couple are making $100,000, you pay $3,000 a year for a supplemental plan. Remember that if you don't have a supplemental plan under Medicare, you are at risk for medical bankruptcy and for unlimited out-of-pocket costs. So the answer is yes, you do still pay in only if as a couple you make over $60,000 or as an individual you make over $33,000 in retirement income. And yes, you do receive a benefit in that ColoradoCare becomes your supplemental plan. The amendment also states that ColoradoCare should apply, the Board of Trustees should apply to become a Medicare Advantage plan, and then you would also not need to get Medicare D anymore.
Okay, thank you very much. And 2 minutes for our opponents.
Well, keep in mind that the tax is going to be in the Colorado Constitution, and the tax exemption is a statute. So when the state gets squeezed for funds, that can go away. The exemption can go away, just like the homestead exemption went away and everything else. So you have to keep in mind the difference. You have to read what's in the amendment. Furthermore, ColoradoCare, it says in the amendment, will not cover you unless you buy Part B and a supplemental. So if you could have bought, and drug part. So unless you bought Part B, which is physician's offices, and Part D, which is drug, along with Part A, then if you just decide to buy Part A, ColoradoCare is not going to pay for any B or D expenses. This is what's known as a simple program, a government program. It's called Medicare. You have to buy 4 policies to have what you get in the private sector, but we won't go there. So ColoradoCare is somehow going to have to keep track of all this, and that's going to add to administrative costs because we don't have to keep track of that right now. The other thing to keep in mind is that a lot of people make money from rents. A lot of retired people work part-time. The exemption applies to retirement income. It doesn't apply to salary income, to rents, to royalties, to interest, or to dividends. So you're still going to be taxed, and you're going to have to pay for your Medicare premiums as well.
One of the most popular programs in Medicare is the Medicare Advantage program. About 20 million seniors voluntarily predict these plans because they don't require extra premiums. They provide much more comprehensive care. Often the drug benefit is included for a much lower cost than they would pay with the fee-for-service Medicare. So seniors who have picked Medicare Advantage would wind up paying twice and probably being taxed 2 or 3 times for the benefits that they have now. They have that choice now with Medicare Advantage, but this would not give them new solutions.
Okay, thank you very much. Let's get to another question from the audience, this one under the topic of insurance. Why is the insurance industry necessary in healthcare? We don't have insurance for fire protection, police protection, food and drug protection. Again, let's wait till it goes to the end of the show, in the end of the debate. Why do we need a middleman between our healthcare providers and our patients? Isn't it simple to provide healthcare as we provide public safety? And we'll start with 2 minutes from our opponents.
Well, obviously insurance is not necessary for health care until Obamacare was passed, at which point you were required to buy it whether you wanted it or not. There is still a thriving cash market in healthcare, and I have one of the insurance policies and have had for 20 years with a $7,000 deductible. I've been paying cash for care for a long time, and I pay about 30 to 40% less than if you go through an insurer. It works quite well. Why would I still keep insurance? Well, I might want protection if I come down with a disease that is so expensive to cure that I want somebody to pay. But that kind of insurance is actually pretty cheap. You used to be able to get it prior to Obamacare in Colorado for about $100 a year. I may need very expensive drugs, so I'd have that. The other thing I might want to do is protect my assets. I may have enough saved up so that I have cash to handle a hospitalization for $50,000 or $60,000 because of my HSA, but maybe I want slightly more insurance. So as you go through life, you need different amounts of insurance. But here we have the government stomping in and saying, oh, we've all got to buy big corporate policies, and by the way, you have to buy it with after-tax income, while people who get it through their employers get it with pre-tax income because of the federal tax ruling after World War II. That's silly, and it needs to be fixed. And the one thing that could have been fixed was the tax exemption. We didn't fix it. Big mistake. ColoradoCare just takes Obamacare and doubles down on it by saying, we're going to have this one thing, it has no accountability. It's like the VA. If it doesn't provide you with care, you're going to have to go out of state, so you're still going to have either cash or coverage. In places like Canada, people buy critical illness insurance so that if you come down with something like you need a hip replacement, you get a lump of cash, because otherwise you're going to sit in a waiting list for 2 years waiting for your hip to be repaired. With the cash, you can come to the U.S., and there are companies that arrange surgery in the U.S. from Canada, because everybody's covered, but nobody can get care.
Okay, thank you very much. That's our 2 minutes. Thank you. Let's go to 2 minutes from our proponents on the insurance question.
So we are in agreement that there is no beneficial role that having an insurer as a middleman serves. And I want to talk to you a little bit about why people need insurance. One of the things we didn't get to talk about earlier is that why is it that we spend $3 trillion on health care every year as a nation? And interestingly, if you look at who spends that money, it's actually only 20% of our population that accounts for 80% of that spending. So 1 in 5 people in our country are unfortunate enough to be sick enough to need a lot of money to pay for their health care. And so those folks often are not able to work and don't have the ability to have a large HSA or to have money available to cover their deductibles. And for the most part, these illnesses and diseases happen randomly. And so it's not something that they planned for. They were very healthy. They didn't expect to need anything, so they didn't have a large reserve, and that comes forward. The other 50% of our population actually only spends 3% of our healthcare dollars. So if you're feeling like, gosh, I really don't need healthcare insurance, I don't hardly ever go to the doctor, why do I have to pay this? Well, what the other 50% is doing is paying for the care for that 20% who does need medical care. But we're doing it in such an inefficient way that's created so many gaming mechanisms that those folks are still struggling to get their medical care, and other folks are making billions of dollars off of their misfortune. And so ColoradoCare says, look, we are a nation that still values life. When somebody comes in and they're really sick, they're our fellow Coloradan, we want them to get the care that they need. And so we are going to have a reserve or healthcare trust fund available to pay for that care when they need it. And we'll all pay into it hoping that we are never sick enough that we need to take money out of that account ourselves.
Okay, thank you very much. Let's get to another audience question. This comes under the title of Center of Innovation. Colorado is positioning itself as the innovation/entrepreneurial state of the nation. Having lived overseas in countries with government-provided and guaranteed health care and worked in the entrepreneurial sector, I saw firsthand that the non-existence of worrying about health care freed individuals to take greater risk in creating businesses. How will ColoradoCare help our state remain a center of innovation? We'll get 2 minutes from the proponents.
This is an innovative plan, and it's absolutely true. All over the country now, people look to Colorado to come up with solutions to policy problems. As you all know, we're the highest state in the country in more ways than one. And our fracking regulations have been copied. Our teen pregnancy prevention plans have been copied all over the country. And this is just another example where people trust Colorado to take on issues. As our opponents have said, the system we're stuck with now in healthcare is not working. Paul Ryan is going to introduce a bill tomorrow. Paul Ryan introduced a bill in 2010, in 2012, in 2014. They never do it. The way this is going to get done is state by state, by innovative states, figuring out ways to provide health care for everybody at reasonable cost. And you know what? This is a tried and true method to bring about change in the United States. A lot of the most important ideas in our country, free public education, minimum wage laws, interracial marriage, recreational marijuana, started in one state. And the other states see that it works and copy it. So this is exactly an example of innovative Colorado taking on a national policy issue and showing the country how to do it. And when we pass Amendment 69 and we make it work, and believe me, Coloradans are responsible, sensible people who can make this work, then we will lead our great country to a destination we should have reached long ago. High-quality health care at reasonable cost for every American.
I just wanted to add one thing to that, which is that, we agree that there are things that need to be fixed in the Affordable Care Act, but I want you to know that since that act was passed, what we've gotten from Congress are 60 votes to repeal it, one that made it all the way to the president, and not one positive change to improve it. And as a state legislator, I can tell you that we have 10% the dysfunction of Congress, and we can't get common sense changes passed at a state level. And so I think we, the people, need to take control with the ballot measure.
Okay, thank you very much. 2 minutes from the opponents.
Bismarck began developing a government-run healthcare system for Germany in the 19th century. Britain developed its own single-payer, government-run healthcare system right after World War II in the late 1940s. This is not a new idea. What would be a new idea is to give people real choice. We have not had a functioning private healthcare system, so people could pick health insurance that works for them from companies that are competing for their business to give them the kinds of policies, the kind of coverage, whether it's insurance companies or a health plan like Kaiser, whether or not, so that they are deciding, not having Washington tell them or the state tell them what kind of coverage they must have, whether or not it's a health savings account, whether or not it's a regular indemnity plan, whether or not it's a health plan that is comprehensive, like an HMO. If people had more choice instead of the kind of cookie-cutter plans that we see today, the market would respond with more affordable choices that people are picking to protect themselves. They do want to make sure they're protected if they get sick or injured, and that's why they will want insurance if they can afford it.
I'm going to talk about the entrepreneurial comment. I know this intimately as I'm married to an entrepreneur who started a business on his desktop and now exports machines all around the world. Taxes are huge. The way that I pay for additional machinery that I need to grow and additional employees is retained earnings from the company. This will 10% out of my company. It's not going to grow anymore. And in fact, it would probably leave the state. Another thing to keep in mind is listen to the language that's being used here. I told you to read the amendment. There is nothing in the amendment that talks about a